Welcome to the second module in the Visionary Board Leadership Program. My name is Shannon Studden, and I'm a Senior Program Specialist with the National Rural Health Resource Center, a national nonprofit organization dedicated to improving and sustaining the health of rural communities. We hope that after the last module in this program, you were able to have some valuable conversations with your colleagues about the transition to value. Today, we'd like to build on these conversations from the first module by exploring what it means to be a visionary leader and how a clear, compelling vision can positively impact your organization's journey to value. Just like last month, you'll hear other rural hospital board members and CEOs share their perspectives on these topics, and we'll leave you with some things to discuss with your fellow board members and a few things to pay attention to between now and the next module. So let's get started. So what exactly do we mean by visionary leadership? And how can it help your hospital successfully navigate the transition to value? In their book, Exceptional Leadership, 16 Critical Competencies for Healthcare Executives, Carson Dye and Andrew Garman define visionary leadership as the ability to see the future clearly and anticipate large-scale and local changes that will affect the organization and the environment in which it operates. Visionary leaders prepare themselves and their organization to address these potential changes as they continue to pursue their compelling vision of the future. Because the transition to value requires a holistic view of health and deeper integration between hospitals and the communities they serve, it's more important than ever for healthcare leaders to think about the environment beyond just the traditional healthcare system itself and pay close attention to trends related to things like population demographics, education, economics, community development, and sustainability. When thinking about a future vision for a complex system like healthcare, it's important to step back from the individual components, like a hospital or clinic, and take a community system view. The reason for this is that we can think about a community's healthcare system as involving all of these entities. They're all interconnected, where a change in one impacts the others. For example, if a large employer opens a manufacturing facility in a rural community, the hospital, clinics, and mental health providers may need to prepare for an influx of new residents in the community. Or consider a community that experiences a large number of teen suicides in a given year. The school system might work to provide educational programs for staff and students. Social service agencies, faith-based organizations, and mental health providers would likely be mobilized, and medical providers and emergency departments might choose to incorporate behavioral health screenings into patient visits. Because of the interconnectedness evident in scenarios like these, we need to broaden the way we define the healthcare system. As a board, as you think about trends and potential future scenarios, you'll want to think about consequences that a change to any part of this system would have on the hospital, as well as the consequences that changes to the hospital might have on other parts of the system.
Our vision for the future is to be the best. So really just to be that premier health delivery model. What that used to mean was, maybe we're going to take care of patients and it's going to be an excellent experience with great quality, high quality outcomes, and that certainly is still a part of it. But being the best these days means so much more than that. It means getting together with community stakeholders and making sure that you're not duplicating efforts. It means addressing issues in the community that are impacting somebody's overall health. It means recognizing if there are substance abuse issues or mental health issues and addressing those. So being the best is way different than I would have defined being the best some years ago. Just as we make this move to value and population health, we really need to get a better understanding of what does best look like. And then that means having conversations with the community to find out what does best look like to them. How do they believe that the care should be and health should be delivered? And then meeting those people where they need to be or want to be met, and involving other folks, public health, other area licensed mental health practitioners, schools, foundations, just the whole host of stakeholders that you might find, religion, so faith, friends, all of those things come into play when you're talking about being the best. And so our vision is to be the best, and that's sort of what encapsulates for us being the best.
A clear, compelling vision gives board members, administrators, leaders, and really everyone in the organization a similar answer to these questions. Why do we do what we do? What are we trying to accomplish? And how does the work that we do impact the community? But a compelling vision goes beyond a presentation of facts. The most impactful visions describe not only how the organization will be better in the future, but how the community will be better because of the work of the organization. As examples, consider these vision statements. A world without Alzheimer's and all other dementia. A world where everyone has a decent place to live. Ensure that veterans are respected for their service, always receive their earned entitlements, and are recognized for the sacrifices they and their loved ones have made on behalf of this great country. There's a story about President John F. Kennedy touring the NASA Space Center in the 1960s and encountering a janitor carrying a broom. When the president asked the janitor what he was doing, he replied, "I'm helping put a man on the moon." There are no records of this encounter, so it's entirely possible that this story is an urban legend. Still, the idea behind the story illustrates the goal of a compelling and widely communicated vision, which is to ensure that every person in the organization understands exactly how the work he or she does contributes to the long-term vision. While the intent of this program is not to help you write the perfect vision statement for your hospital, we would like to encourage you as a board to think about and discuss your vision. What are your hopes and aspirations for the future of the hospital, and for its role in the future health of community members? What's exciting to you about these future possibilities? The writing of the vision statement can come later. The first step is to clarify it in your minds as those responsible for setting the future direction of the hospital, and to spend some time talking about the aspects of the vision that are most compelling to you personally. When the senior leaders of an organization share a common vision of the future that personally inspires them, the enthusiasm they feel is passed on to others, and this is when significant change can happen. Here's a concept we'll come back to a few times over the course of this program. When the leaders of an organization have a clear vision that inspires them and they share that vision with others, it results in direction, alignment, and commitment for everyone involved. Direction means that all employees have a common understanding of what they're working toward, and community members are aware of the hospital's goals for the future as well. Alignment means that work is coordinated in service of the shared direction, rather than diluted as different groups work toward competing goals. Commitment means that employees and partners feel mutual responsibility for the vision, and they prioritize collective success of the organization over individual interests. And when you have direction, alignment, and commitment within an organization, it makes planning and decision-making much clearer at all levels of the organization. Leaders have less of an urge to micromanage when a shared vision provides the roadmap. Employees are empowered to make decisions that are aligned with the vision. Department managers know that any plans they develop for their department need to be aimed toward the vision. Senior administrators determine the best way to carry out strategic plans that have been created with the vision in mind, and board members are left free to focus on their primary responsibility, which is to set and act as stewards for the vision. And when you're working with partner organizations, as is often the case in our interconnected healthcare system, it's just as important for all involved parties to have a common vision in order to have direction, alignment, and commitment across all groups. If you think this sounds challenging, you're right. And in our next module, we'll talk about some strategies for working together with partners to create a common vision that supports your collaborative work.
Big Fork Valley's vision to provide a continuum of quality services impacts me directly in that I am a member of the community. My wife is a kindergarten teacher at the school. We try to have a very collaborative partnership with the school and the youth of our area. The youth one day hopefully will be our future workforce. My children receive quality care at Big Fork Valley. I want all of our community to experience that same quality care. We really want to be able to keep people in our community providing services at whatever stage of their life they need.
I'm a small town boy. I grew up here and I live here and I probably always will. the hospital it's essential to a small community to have your hospital. It's so tough on people when you have a ill family member, be it a child, a parent, a spouse, whatever, a close relative, a close friend. It makes it so much more convenient for everyone and easier on the family to do everything locally. Also is the idea of, when you come into St. James Parish Hospital, you are not a number. We know you by your name, we know your parents, we know your family, we know everyone. And you're getting personal attention. And I guess it's good to have a smart doctor, it's good to take the right drugs, but that personal attention is important too. It might be the most important thing of all, because people have to have a good attitude towards life and a good attitude towards their local hospital. And the more things we can do which are viable for us to do, let's say locally, so it's convenient for someone. They don't have to drive to New Orleans or Baton Rouge or Thibodeau and spend all this time on the road. Especially, you can have a problem in the middle of the night. You don't want to drive in the middle of a rainstorm or somewhere else 50, 60 miles and you arrive in ER and nobody knows you. I mean, it's important that we do everything we can that's reasonable for us to do. And also that we've set up things where we can provide those other services through trusted partners on things we can't do locally. That's my vision. We do everything we can, and what we can't do, we make sure that people get the best quality care that's available through our partners.
In our next module, we'll continue on the topic of the transition to value by exploring strategies for developing partnerships and engaging in collaborative decision-making as you work toward population health goals. Between now and then, however, we'll ask you to consider these questions and be prepared to share your responses at your next board meeting. How do you stay up to date on national, state, and local trends? Where do you get your information? What additional information would you like to gather in order to continue building on your vision for the future? Where can you get this information? What are your hopes and aspirations for the future of the hospital and for its role in the health of community members? What's exciting to you about these future possibilities? Do you envision a role for partner organizations in this future vision? As you contemplate these questions over the next month, we encourage you to consider talking with others in your community to find out about their vision for the hospital and the future of health services in the community. These conversations may provide you with valuable insights into the expectations that your community has for your facility and their vision for the future. For additional information and resources on any of the topics covered in this module, please see the resource guide that accompanies this program by searching for Visionary Board Leadership within the Center's resource library. And of course, please feel free to contact us at the Center anytime for additional support. We thank you for joining us today, and we look forward to continuing the conversation over the next few months.